So a few pearls. I think that the evaluation of the polytraumatic patient has to be protocolized by the ATLS guidelines. It makes it the same for every patient every time. It doesn't matter which group goes down there. It doesn't matter if I'm there, a resident, a different nurse practitioner or PA in our group. It's going to be done the same way every time, and that way we don't miss everything. The collaborative approach has to be there. This trauma is a team sport. We are not going in there in isolation. We're in there with a lot of people who feel like their portion of the exam is the most important, and I'll give it to them. That's fine, but we're going to be there too, and we're going to work together to make sure that the patient is taken care of. Knowledge and appreciation for the process of damage control orthopedics. I think that's important for our brains to be thinking about. If I know that a third case OR slot is open, is this patient that's already intubated, sedated, or doing repeat CTs of the head, that's probably not going to be that patient just to throw in that slot. Just knowing that process and appreciating it for our planning. Again, examine the patients the same way every time. And this kind of goes into one a couple down where you never fail to conduct that complete exam. It's very easy when you're busy and you get called for the fingertip amputation to go down there and just look at the finger. Well, how do we know they didn't fall afterwards? You've got to do it the same way every time. And I think that sometimes our residents can get swayed to go for what you were called for, but we know better and we're going to assess the patient fully. Addressing these time-sensitive urgencies and emergencies and getting everyone on board that we're going to need to be moving, and we're going to need to be moving fast. Take off splints. Know your resources, the front desk, the radiologist, the ER secretary. All these people are going to help us get the patient where we need them to be. And knowing that we're the experts. When we go down there, the ED is very global in nature. If they're calling us with an orthopedic injury, we can own that. But not just the orthopedic portion of that exam. I think it's important that we are aware and can speak to all the injuries that the patient has, because that's what's going to keep them from going to the OR and keep our attendings happy to know what the plan is for these patients.